Hello, Nick and Gretchen. Since we're bringing Nick on right now and Gretchen at the same time, I wanted to kind of give Gretchen an overview of both Nick and Cindy, and we're going to focus on Nick's CV here so that you can kind of know what it all means. Obviously, it's important as people are calling in and you're discussing the therapists that you know their background and the things they're good at treating and all that kind of stuff. And as you'll see, I've been incredibly lucky with Nick that there's almost nothing that he doesn't treat when it comes to, any kind of pain or injury from head to toe. That's orthopedic in nature. So let's kind of run through it here and just kind of Nick, I'm sure will be blushing throughout this, but again, I think it's just important that everyone in the team know exactly, the backgrounds and the things that our therapists are really great at. So Nick, like me, graduated way back in 2002 from Wisconsin La Crosse. Love La Crosse, great town, really fun college town up there. Went straight into getting his master's in physical therapy, and then 4 years later, he got his doctorate. So he has both a master's and a doctorate in physical therapy, and is now over 15 years into into his PT career. So lots of experience, and as you'll see, just has had an ongoing focus on education. And just improving himself as a manual therapist and physical therapist as a whole. So then he went and got his manual therapy fellowship. And this is a really big deal, actually. It's an intense program that therapists can go through. Nick can correct me if I'm wrong, but I think it's 1 to 2 years. I think it's actually 2 years probably for most people to get in the amount of hours of mentorship under another or a group of other fellowship trained manual therapists. So just hundreds of hours of training and mentorship. And you come out of it as just a stellar hands-on manual therapist. So he did that back in 2010. But as you'll see, he did not stop there. And with all the continuing education, he's really kind of covered everything from head to toe. So then, a variety of positions he's held, including being part owner of a group practice in Phoenix, Arizona. So he is a peer-reviewed published author. And this one was in the International Journal of Sports Physical Therapy, focused on the shoulder. He's also had other peer-reviewed scientific and professional presentations that he's been a part of or that he's created and presented. This one on the cartilage defects of the knee, lumbar spine imaging. This one I think is of particular interest to me when I saw it, because there are so many times that patients will have an MRI or have, some sort of imaging and they're like, oh, that's it, and that's my pain and I need surgery or I need this or that. And actually a lot of times what we see on imaging does not correlate clinically with what the patient is actually feeling and how they're moving. And so it's important to know those differences so that we can kind of educate a lot of patients who are in that scenario that, hey, just because your MRI shows XYZ, it's not, that's not what we're seeing when you tell me your pain is, here and there and when you move in this way or that way. So the fact that he's done a whole peer review presentation on this, I was really excited about. Then we got thoracic spine. We've got more on the shoulder. He's a member of the APTA and the Texas PT Association, as well as the special sections of the APTA on sports and orthopedics. And of course, he's a member of the American Academy of Orthopedic Manual Physical Therapy when he became a fellow, or member and a fellow of that academy. So, excuse me. All right, so 4.0, going through his fellowship, dean's list, writing awards, all kinds of highest honors, this and that, and just freaking awesome. So we got TMJ, craniomandibular means TMJ, so the jaw joint. So these are now we're looking at kind of different continuing education courses or series of courses. He's done a lot of work in trigger point dry needling. Some people say, dry needling, or some say trigger point needling, but it's all, the same. He does a lot of great work with needling. It was great. I was excited to see this. We definitely have our share of ankle sprains and foot issues come through the clinic. Even balance and vestibular work in courses that he's done. Hip and knee is big. We see a ton of hip and knee patients, and he's trained. Some of these instructors and people that he's trained with are well known throughout the PT world. So I was excited to see all this. Even Pilates. Well done, Nick. Getting broad. Broad in your approaches, and which I love, because we do really see things from head to toe. We're such a broad population of wonderful people that we see and things that we get to help with. So I was, this was one of the reasons I hired Nick, and I was so excited to see his CV, that he had such a broad span and really has looked at every part of the body. More on the shoulder, then lower extremity, lumbopelvic. That's probably one of our biggest things that we treat is, back pain. Essentially, and the population as a whole, it's the most common thing that is needed, or that physical therapy is needed for. More trigger point dry needling, manipulation. So snap, crackle, pop, kind of stuff. He's manipulated me. He's worked on my neck. We got, I saw there's a cervical spine one down here as well. And he just has fantastic hands. I can attest to that myself, and I know that you'll be hearing that more and more as patients are giving you feedback on the phone as you're talking about Nick and when they've been treated. Some more on the back and neck, and then to round it out, he was a clinical instructor back at University of Wisconsin. Their clinical instructor means that he took on PT students, and was their instructor for a series of weeks or months. But he was also a mentor to other, as a fellow of the Manual Therapy Academy, he's mentored other fellows through that year or two of all those hours. And it's a big thing. So, and I know as someone who's done a lot of mentorship, teaching these things really solidifies it and makes you even better. So again, I was really excited to see that he's gotten into training and instructing and mentorship. And of course, to round it out as well, he's been an adjunct professor. So, really, really broad yet deep focus on all parts of the body, orthopedic wise. And I know he's a phenomenal clinician. And, hopefully with this, you'll be able to talk him up a little more in detail. Not that you would necessarily, focus on or list all these things, but just to have a good idea of what he's capable of, and the incredible 15-year career he's had so far, and the manual therapist that he's become. I'm just so excited, Nick, to have you on the team. Thank you again, and thank you, Gretchen. I'm so excited to have you as well. And I'll go ahead and end this here if I can figure out where the stop button is on this thing. Thank you, guys.